What's up, guys? See if I can fix this just a touch. All right. Um, Look, we all know opiate withdrawal can be brutal. Well, there is a new medication that has been approved for the treatment of opiate withdrawal symptoms. That medicine is called Lucemyra, and it is non-addictive, which is cool, right? And typically, you only have to take a 9-day course of it, basically during your acute withdrawal phase. And it's 7 days of like the standard dose, which is like, let me look at I think it's like 3 pills 4 times a day. It's a lot, but it's 3 pills 4 times a day for 7 days, and then you taper down those last few days, the last 2 days. And the reason you taper down is because this medication, if you just stopped it abruptly, could possibly cause your blood pressure to go high. But if you taper down, that's typically not an issue. This medicine is kind of in a similar family to an old blood pressure medicine that we use a good bit. And it helps to block opiate withdrawal symptoms. And it seems to work pretty well. It looked like in the studies, about half the people who are on the medication finished the study, okay? And look, man, when we're trying to treat addiction, we'll take anything we can get. So it sounds like, half the people, either the withdrawal was too bad or, maybe the cravings were too bad. I don't know exactly why they all dropped out. Maybe it was the side effects, and it might have been a combination of all these things. Whereas the people who were treated with placebo, a third of them dropped out. I'm sorry, I said that wrong. The people treated with placebo, 2/3 of them dropped out. Okay, and so it does seem to be effective, and that was statistically significant. So it does seem to be effective for a lot of people in treating these withdrawal symptoms. Okay, so but what you want to know is it safe? What side effects would you have while taking it? And those are good questions. And so because it's in that family with blood pressure medications, we know that it can drop your blood pressure. And that's one of the common side effects is what we call hypotension, low blood pressure. Or the blood pressure drops when you go from sitting to standing or lying to standing, which could lead to things like such as passing out, okay, which doesn't sound good, doesn't sound fun. The number one side effect listed is actually insomnia, but my guess is, and that was like 51% of the people, but if you look, 49% of the people getting placebo had insomnia, and if you think about it, if you have severe, or if you're going through opiate withdrawal, you're probably not sleeping very well. So it may just be that those folks their symptoms just weren't as well controlled, okay, and they weren't sleeping well. Which we know is a side effect of opiate withdrawal as well. So, or it could be the medication. I don't know. But it seemed like the more significant things were the low blood pressure, passing out, and a low heart rate. And so there's no absolute contraindications to taking the medication. But, if you've had heart problems, if you're on medications that slow your heart rate down or cause what we call QT prolongation, your doctor needs to be aware of that. You may have to have an EKG before you start it, but not everybody necessarily. But those are just some things to consider. But overall, it does seem like it's a fairly safe medication. Definitely likely safer than, taking heroin or copious amounts of pain pills. And that's what we're trying to stop, right, guys? But that leads to another point, that this medicine is for opiate withdrawal, not opiate addiction, and there's a difference. So depending on where you're at with your recovery, will kind of help depend on whether or not this medication will be good for you. Now, some people, are on Suboxone, and so maybe they're on medication-assisted therapy with Suboxone or Subutex, and they're tapering down. Maybe they're having a difficult time just completely stopping because of withdrawal. Well, guess what? You can use this medication to help you with withdrawal symptoms, and finally, take that last step to get off medications. Maybe you've got your counseling set up. You've got everything to kind of go through the recovery process of your mind from addiction and to help you with the addiction, and you just need to get through the withdrawal. Well, this medication may be right for you. There's lots of possibilities with this. I'm excited about it. I think it's going to help a lot of people. It's just a matter of tolerating some of those side effects, making sure it's safe for you. And so I definitely cannot give you medical advice on this medication. So remember, this video is just for information purposes, entertainment, and go talk to your doctor about whether or not this can help you, okay? If you have, general questions or comments about this, feel free to leave them below. I'd love to have a conversation about it. But again, I can't tell you if it's right for you because there's a lot of things in play. And but if you're my patient, come see me and we can discuss if you're interested in this or not. So I think I covered everything. I'm sure there's something I left out, but I think that's the main gist. All right, guys, drink some coffee. Have a good day.